Dr. Harlan Voss grabbed Laura's wrist so hard she felt the bones compress. He yanked her sideways, slamming her back against the supply cart, scattering instruments across the floor, and pressed his face inches from hers. "Touch my patient again," he hissed, his breath hot and sharp, "and I will end your career tonight." The entire trauma bay went silent. Nobody moved. Nobody said a word. A woman was bleeding out on the table 3 feet away, and the head of emergency surgery was spending his seconds threatening the one person in that room who actually knew how to save her. Nobody spoke up. Nobody stepped forward. Nobody except Laura. If this story already has you hooked, do me a favor right now. Hit that subscribe button, drop the name of your city in the comments below, and follow this story all the way to the end. I want to see just how far this one travels. Now let's go back to where it all began. It was a Tuesday. That mattered, somehow, because Tuesdays at St. Alder's were supposed to be quiet. Not slow exactly, not boring, but manageable. The kind of shift where you could take a real lunch break, where the supply closets were stocked, where nobody was running. That was the plan anyway. Plans have a funny way of dying the moment they meet the real world. Laura Keating had been at St. Alder's for 11 days. 11 days of intake forms. 11 days of vital checks. 11 days of answering to people who had decided within the first 5 minutes of meeting her that she was pleasant, competent, and entirely unremarkable. She had a soft voice. She wore her dark hair pulled back tight. She didn't push. She didn't perform. She showed up early. She did the work. She went home. That was the picture everyone had painted of her, and she had let them paint it. She was good at that, letting people see what they needed to see. That morning, she had poured herself a cup of coffee in the break room when Dr. Priya Nair walked in, still buttoning the top of her white coat, her stethoscope swinging like a pendulum around her neck. Priya was a second-year resident, the kind of doctor who moved fast and talked faster. Someone who had decided early on that enthusiasm was its own form of competence. "Morning, Laura. You ready for another riveting day of triage paperwork?" Laura looked up from her coffee. "Every day's a gift." Priya laughed. "That optimism is honestly terrifying." She grabbed a granola bar from the counter, tore it open with her teeth, and leaned against the refrigerator. "You know they've got you on intake again today, right?" "I know." "Doesn't that bother you?" Laura took a slow sip of her coffee. "Not particularly." Priya studied her for a second, like she was trying to figure out if that answer was genuine or something else entirely. She never quite landed on a conclusion. "You're a strange person, Laura Keating," she said, and walked out. Laura finished her coffee alone. The morning was unremarkable. She processed 12 intake forms before 10 o'clock. She flagged a mild allergic reaction in Bay 4, notified the attending, watched them administer antihistamines, watched the patient's color come back. Standard. She helped an elderly man named Gerald Hoffman find his glasses, which had fallen under the gurney while he was being prepped for a chest x-ray. He squeezed her hand and said, "You're a good girl." She thanked him and moved on. Nobody noticed anything unusual about her. That was fine. That was the way she preferred it. At 11:47, the radio crackled at the nurse's station. Dispatch. A bus, Route 14, heading southbound on Mercer Avenue, had rear-ended a concrete divider at highway speed. Early report. Multiple casualties. Estimated arrival of first units, 12 minutes. The charge nurse, Sandra Okafor, a broad-shouldered woman with 20 years of emergency medicine behind her and a voice like a foghorn, stood up from her chair and looked at the floor. "All right," she said. That was all she said, but everyone who heard her understood immediately. The ER began to move. Laura moved with it. She restocked the trauma bays without being asked, laying out IV kits, airway trays, suture supplies with the kind of quiet precision that looked routine from the outside. Nobody told her what to go where. She just knew. She pulled extra units of O-negative from the blood bank refrigerator, logged them, stacked them in the cooler closest to Trauma 1. She checked the crash cart. She checked it again. Sandra passed behind her and paused. Keating, I've got you on intake. Families, information, paperwork. You stay at the desk. Understood, Laura said. Sandra moved on. Laura turned back to the trauma bay and made one last adjustment to the supply tray, centering a pair of scissors that had been sitting slightly off angle. Then she walked to the intake desk, sat down, and folded her hands. The first ambulance arrived at 12:19. The paramedics came through the doors at a run, a gurney between them, a woman in her 50s, unconscious, her face gray, her breathing shallow and too fast. The lead paramedic was already calling out vitals before they'd cleared the doorway. BP's 80/50 and dropping. Blunt abdominal trauma, possible internal. She's been in and out since we loaded her. Dr. Whitmore was there to meet them. Edmund Whitmore, head of emergency surgery, a tall man with silver at his temples, and the particular kind of authority that comes from having been the smartest person in every room for 30 years. He took one look at the woman and pointed toward Trauma 1. Let's go. The room flooded with activity. Nurses, residents, equipment rolling across tile. Laura watched from the desk. She signed intake forms. She answered the phone. She made notes. The second ambulance arrived 4 minutes later. 2 patients this time. A teenage boy with a broken arm and a scalp laceration, conscious and frightened, calling for his mother. An older man, maybe 60, who wasn't calling for anything. His eyes were open but unfocused, staring at the ceiling of the ambulance bay with an expression that belonged somewhere far away from St. Alder's Hospital. Laura watched the older man go past on the gurney. She watched the way his chest moved. She noted the color of his lips. She did not stand up. Not yet. The third ambulance, the fourth. The ER was filling. Voices overlapped. Monitors alarmed and were silenced and alarmed again. Dr. Whitmore moved from bay to bay with controlled urgency, assessing, ordering, delegating. Priya Nair was running. Everyone was running. Laura was at the desk, filing papers, answering phones, doing exactly what she'd been told to do. Then she saw the woman in Bay 6. She hadn't been brought in by ambulance. She'd been helped through the doors by her husband, a heavy-set man in a paint-stained jacket who was saying, over and over, "She's fine. She just hit her head. She's fine. She told me she was fine." The woman herself, maybe 40, brunette, was walking under her own power, pressing a folded piece of gauze to her forehead. She was even smiling a little, a thin, apologetic smile, the kind that said she was embarrassed to be here, embarrassed to be taking up space. A young nurse named Danny Cho brought her to Bay 6 and started the intake questionnaire. The husband hovered. The woman said her head hurt, that she was a little dizzy, that she thought she might have briefly lost consciousness after the crash, but she wasn't sure. Maybe it was just the shock. Danny nodded, took notes, said the doctor would be with her soon. The doctor would not be with her soon. Every physician in the building was currently occupied with patients who were bleeding or not breathing, or both. Laura watched the woman in Bay 6 from behind her desk. She watched her answer Danny's questions. She watched the way she occasionally paused mid-sentence, not from thought, from something else. She watched the woman's right hand move, twice, without apparent purpose, to the left side of her neck. Not touching, just drifting. The way a hand moves when something hurts, and the brain hasn't fully registered it yet. Laura set down her pen. She walked to Bay 6, calmly, no urgency in her stride, nothing that would alarm anyone. "How are you doing?" she asked the woman, whose name, according to the intake form Danny had started, was Carol Merritt. "I'm okay," Carol said, the smile again. "I'm fine. I just need a little stitching up, I think. Can I ask you something? When you lost consciousness in the car, do you remember if it was right at impact or a few seconds after?" Carol thought about it. "I think after, maybe. It was just for a second. Was there any pressure? In your chest? Or maybe your shoulder?" Carol opened her mouth to say no. Then she stopped. Her eyes went somewhere internal for a moment. My shoulder, she said slowly. My left shoulder. It aches. I thought it was from the seatbelt. Laura nodded pleasantly. She looked at Carol's face. She looked at the set of her jaw, the way she was breathing, the subtle pallor beneath her tan. She looked at Carol's husband, who was scrolling on his phone now, reassured. She put her fingers gently against Carol's wrist. Not on the radial pulse point, slightly lateral, slightly medial, cross-referencing. Has anyone checked your blood pressure since you came in? Laura asked. I don't think so. Let me do that for you, she turned to Danny. Can you get me a cuff? Danny looked mildly confused. I was just doing the intake. I know. A cuff, please. The BP read 94/61. Laura read it twice. She kept her face completely neutral. I'll be right back, she told Carol. She walked directly to the charge desk and found Sandra in the middle of a phone conversation. She waited exactly 3 seconds. Then she said, quietly, but with a quality in her voice that made Sandra look up immediately, Bay 6, Carol Merritt, BP 94/61, left shoulder pain referred from neck, brief post-impact LOC. She needs a CT, abdomen, and chest. Sandra held her gaze for a moment. She walked in on her own. Yes. She's not flagged for priority. I know. Something passed between them. Sandra ended her phone call. She looked at the board. She looked back at Laura. I'll see if I can pull Nair. Thank you. Laura returned to the desk. She sat down. She picked up her pen. From Bay 6, she heard Carol laughing at something her husband had said, that thin, social laugh, and it made something tighten in Laura's chest that she kept very carefully off her face. 18 minutes later, Priya Nair came sprinting past the desk toward Bay 6. She had a look on her face that Laura recognized. The look of someone who has just seen a scan result and is trying very hard not to let the scan result show on their face. The husband stood up. What's happening? What's wrong? Sir, I need you to step back. Is she okay? What did the scan show? Sir, tell me what's wrong with my wife. Priya put a hand on his arm, turned him firmly but gently toward the hallway. Mr. Merritt, your wife has bleeding in her abdomen. We need to address it right now. I need you to trust us, and I need you to wait right there. Can you do that? The man's phone clattered to the floor. Nobody stopped to pick it up. Laura did not look up from her intake forms, but her jaw was tight and her hands, just for a moment, were not quite steady on the keyboard. That was the first one. There were more to come. By 1:15, the ER had received 31 patients from the Route 14 crash. 11 were critical. 3 had already gone up to surgery. The hallways were loud in the way that emergency halls get loud when the noise isn't human anymore. When it's all beeping and wheels and terse, abbreviated commands and the particular silence of people who are trying very hard not to say the things they're afraid of. Laura was still at the desk. At 1:32, a paramedic team came in with a man, maybe 35, athletic build, who was conscious and angry about it. His name was Tomas Reyes, and he had a compound fracture of his left tibia that was visible, dramatic, and immediately commanding of everyone's attention. He was loud. He was cursing in English and Spanish. He wanted to know where his sister was. He wanted ice. He wanted to know why nobody was helping him. He was, in the particular way that visible, dramatic injuries sometimes are, a very effective distraction from everything that might be wrong with him that wasn't visible. Laura watched him come in. She watched the paramedics. She watched the attending resident go to him. She watched the organized theater of dealing with a patient who could tell you exactly what was wrong. And she watched, because she was watching everything, the way Tomas Reyes's breathing had changed in the last 90 seconds since he'd entered the building. Not shallower, faster, and slightly off rhythm, the way breathing gets when something is pressing against it. She stood up. Sandra saw her move. Keating, his breathing's changed. He's in pain. He's got a tachypnic shift that started after he was moved from the gurney to the bed. Pain doesn't pattern like that. She was already walking. Left side. If there's a rib fracture nobody caught on scene, Laura, Sandra's voice had an edge. You are not the attending. You are on intake. I understand you flagged Merritt correctly, and I respect that. But this floor cannot run if every staff member decides to. Sandra, Laura stopped. She looked at the charge nurse directly. I am not asking for credit. I am asking you to have someone put a stethoscope on his left lung field right now. That's all. If I'm wrong, I'll do intake for a month with no complaint. A beat. One beat. Sandra picked up the phone. Nair, Bay 9, respiratory check on Reyes, left lateral. Now. 4 minutes later, Priya Nair discovered a pneumothorax. Small, but there. Developing. She ordered a chest tube. Tomas Reyes stopped being loud. He got quiet in the way people get quiet when the medication hits, and the fear finally surfaces, and they understand all at once that they were closer to something terrible than they had known. He lay back on the bed with his eyes on the ceiling, and when a nurse took his hand, he gripped it. Laura was at the desk. Doctor, Whitmore came out of Trauma 1 at 1:58, gloves off, face tight. He stopped at the nurse's station and looked at the board. He had been told about Carol Merritt. He had been told about Tomas Reyes. He had been told, briefly, who had made both calls. He looked over at the intake desk. Laura was on the phone, speaking quietly to a family member about their son's status, her voice calm and unhurried, and full of a specific kind of steadiness that people need when they're frightened. Whitmore watched her for a moment. His expression was unreadable. He went back into trauma. At 2:12, they brought in the woman who would change everything. Her name, according to the paramedic report, was Diane Cawley, 37 years old. She had been in the back of the bus with her 8-year-old daughter when the crash happened. According to witnesses, she had thrown herself over the child on impact, absorbing the brunt of the collision with her own body. Her daughter, Maya, had a broken collarbone and a concussion. She was already upstairs, stable, asking for her mother. Diane Cawley arrived unresponsive. The paramedic called her vitals as they moved. BP 110 over 70, pulse 110, GCS 7. She was conscious on scene, declined twice on transport. Trauma to the left flank, possible abdominal. She was protecting her left side hard before she went under. They moved her to trauma 2. Whitmore followed. Laura stood up from the desk. She didn't say anything. She just stood. Sandra looked at her. Keating. Laura looked at the board, looked at trauma 2, looked at Sandra. Her pressure's going to drop, Laura said. It wasn't a question. It wasn't tentative. It was the voice of someone stating a physical fact, like saying water flows downhill. Left flank trauma, mechanism consistent with lateral crush, GCS decline on transport, her spleen. If it hasn't started bleeding yet, it will. Sandra stared at her. Whitmore is in there. I know. He's the best trauma surgeon on this floor. I know that too. A long pause. The monitors beeped. Somewhere down the hall, somebody was crying. Then trust him, Sandra said. Laura sat back down, slowly. She picked up her pen. She looked at the intake form in front of her. She read the same line 3 times without registering it. Her hands were still. At 2:26, Trauma 2's monitor alarmed. Diane Cawley's blood pressure had dropped to 78 over 40. She was going into shock. Whitmore's voice carried through the curtain. Push another leader. Get me a surgical consult. I need a fast exam now. Laura was already on her feet. She walked to Trauma 2. She did not knock. She pushed the curtain back and she walked in, and she looked at Diane Cawley on that table. And then she looked at the ultrasound screen that the resident had just pulled up. And she said, clearly and without hesitation, that's a grade 3 splenic laceration. She needs the OR. Right now. Not in 5 minutes. Right now. The room went very quiet. Whitmore turned around. He was not a man who was accustomed to being interrupted in his own trauma bay. He was not a man who was accustomed to nurses walking in uninvited and making surgical calls. His face did something complicated, a progression that moved through surprise and irritation and landed somewhere in the vicinity of cold authority. "Who are you?" he said. "Laura Keating, intake nurse, and she's going to arrest if you don't move her." He looked at the ultrasound. He looked at the BP readout. He looked at Laura with the kind of look that says everything and says nothing. Then he looked at his resident. "Get me OR2 now." He did not look at Laura again, not then. But as they wheeled Diane Cawley out of Trauma 2 toward the elevator, he paused for exactly 1 second beside the curtain, and without turning around, he said very quietly, "You better be right." Laura didn't answer. She walked back to the intake desk. She sat down. She straightened the forms in front of her. Her face was composed and her back was straight, and if anyone had looked at her hands under the desk, they would have seen that they were pressed flat against her thighs, very still, the way hands get when they're working hard at stillness. At 3:41, Dr. Whitmore came back down from the OR. He stopped in the middle of the hallway. He looked at the nurse's station. He looked at the intake desk. Laura was on the phone again, head down, writing something. He stood there for a long moment. A nurse passed him. A resident asked him something about a patient in Bay 7, and he answered without looking away from the intake desk. Then he walked toward it. He stopped in front of her. Laura finished her sentence on the phone, asked the family member to hold, and looked up. Whitmore looked at her for a long moment. His face had done that complicated thing again, but it had resolved now into something harder to read, something that wasn't quite admiration and wasn't quite discomfort, and was maybe a little of both. "Ruptured spleen," he said. "Grade 3, like you said. Another 20 minutes and she would have bled out." Laura nodded. "You were watching her from intake." "Yes. You've been watching all of them." She didn't answer that one. Whitmore pulled a chair from behind the desk and sat down. Not behind the desk, in front of it, like someone who is preparing to have a conversation rather than conduct an inspection. That in itself was strange. That in itself made 2 passing nurses slow down without meaning to. "Merritt," he said, "splenic bleed. Reyes, pneumothorax. Cawley, grade 3 laceration." He looked at her. "Those are 3 catches in 3 hours that any one of us could have missed. That we did miss. Your team was managing a mass casualty event. That's not a failure." "I'm not talking about failure. I'm talking about you." He leaned forward slightly. "What you did in there with Cawley, you didn't just flag a concern. You walked into my trauma bay and you made a surgical call. That's not nursing school. That's not intake training. Where does that come from?" Laura looked at him steadily. "I've seen a lot of trauma." "Where?" A pause, short but real. "Does it matter?" Whitmore tilted his head. His eyes were sharp and direct, and they were doing what a good diagnostician's eyes always do, looking for the thing underneath the thing. "It matters to me," he said, "because I have surgical residents who've been training for 6 years who couldn't have done what you did today. And you've been here 11 days filing intake paperwork." Laura looked down at the form on her desk. She picked up her pen. She turned it once in her fingers and set it back down. "She has a daughter," Laura said. "Upstairs, with a broken collarbone." She paused. "The little girl's name is Maya." Whitmore waited. "She'll be okay," Laura said. "Diane, she'll be okay." It wasn't an answer to his question. He knew that. Laura knew that he knew that. But he let it sit, because sometimes a non-answer tells you more than an answer would. He stood up slowly, like a man who has been moving fast for hours and is feeling it now. He looked at Laura one more time. Then he looked away. "Get some rest," he said, "if you can." He walked back toward the trauma bays. At the door he stopped, didn't turn, and said over his shoulder, "Good work today, Keating." Laura looked at the intake form in front of her. She found the lines she'd been reading 3 times. She read it a fourth time. This time it went in. She kept working. Down the hall, through 2 sets of doors and up 4 floors, a woman named Diane Cawley was out of surgery and beginning, slowly, to come back to consciousness in a recovery room. And in the pediatric ward on the 6th floor, an 8-year-old girl named Maya was sitting up in her hospital bed with her arm in a sling, asking the night nurse for the 4th time when her mother was coming. And the nurse, who had just checked with recovery, was finally able to say something true. Laura didn't know any of that yet. She was still at the desk, still working. The chaos was beginning, just barely, to find its edges. And the room was getting quieter, the way rooms do after catastrophe. Not peaceful exactly, but exhausted. The deep, tired quiet of people who have pushed hard against something terrible and are starting to understand that they held. Laura Keating had been at St. Alder's Hospital for 11 days. Nobody knew her. Not really, not yet. But something had shifted in that building today. The way ground shifts before anyone above it notices. Deep and quiet and fundamental. Edmund Whitmore felt it when he walked back into Trauma 1. Priya Nair felt it when she passed the intake desk and glanced over without quite meaning to. Sandra Okafor felt it when she sat back down at the charge station and looked at the shift log, at the 3 names, at the times, at the flags. They didn't have language for it yet. They would later. For now, there was just the low hum of a hospital at 3 in the afternoon, and a woman at a desk with good posture and steady hands finishing her paperwork. 3:51 p.m., Sandra Okafor did not go home at the end of her shift. That was the first sign that something had changed. Sandra left on time every day, not because she didn't care, but because she had learned, over 20 years of emergency nursing, that the people who stayed late out of guilt burned out before they were 50. She had a system. She had a life. She had a daughter in the 6th grade who needed help with long division, and a husband who cooked dinner at 7 and didn't like eating alone. But at 3:51, when her replacement, a compact, efficient nurse named Val Torres, came to take over the charge desk, Sandra didn't pick up her bag. She stood there looking at the board, looking at the 3 names she'd already circled in her mental log. Merritt, Reyes, Cawley. Val looked at her. "You staying?" Just a few more minutes. Val followed Sandra's line of sight to the intake desk, where Laura Keating was still working, still upright, still moving her pen across forms with that particular quality of focused stillness that Sandra had been trying to put a name to for the last 2 hours. It looked like calm. It felt like something else. "Is she okay?" Val asked. "She's fine," Sandra said. Then she added, almost to herself, "I'm not sure what she is." She watched Laura for another 30 seconds. Then she walked to the intake desk and sat in the empty chair beside her. Laura glanced up. "You should go home. You've been here since 7 this morning. So have you." Sandra put her hands flat on the desk. She was a direct woman, always had been. She had no patience for circling a subject. "Where did you work before this?" Laura kept writing. "It's on my resume. Your resume says 3 years at a county clinic in rural Georgia and 1 year at an urgent care in Tennessee. That's what it says." She paused. "That's not what today says." Laura finished the form she was writing, set it in the out tray, and pulled the next one from the stack. "What does today say?" "It says you have seen things I haven't seen, and I've been in emergency medicine for 20 years. A long pause. Laura looked up. Her gray eyes were steady, and for a moment there was something just behind them, something that moved the way deep water moves, slow and dark, and with a great deal of weight to it. "I've been around," she said, and then she smiled just slightly, just enough, the smile of someone who has answered a question by not answering it, and went back to her forms. Sandra sat there for another moment. Then she stood, picked up her bag, and walked to the door. She stopped with her hand on the frame. Without turning, she said, "The little girl on 6 is asking for her mother." Laura's pen slowed. "Someone told her the surgery went well," Sandra continued, but she hasn't heard it from a person she trusts yet. She's 8 years old, and she's been alone in that room for 2 hours. She left. Laura set down her pen. 4:08 p.m. The pediatric ward on the 6th floor was a different kind of quiet from the ER. Softer. The lights were warmer. The sounds were smaller. A television played somewhere down the hall, some animated show with bright colors and a cheerful soundtrack that felt, in that moment, like the loneliest sound in the world. Room 614, Maya Cawley, 8 years old, broken collarbone, concussion, listed as stable. Laura knocked lightly on the doorframe. The girl inside was small, dark-haired like her mother. She was sitting up in the bed with a stuffed rabbit on her lap and her good arm wrapped around it, and she was staring at the door with the particular expression of a child who has been waiting so long for something that hope and fear have become indistinguishable. "Hi, Maya," Laura said. "My name's Laura. I work downstairs." Maya looked at her. "Are you a doctor?" "I'm a nurse." "Did you help my mom?" Laura walked to the chair beside the bed and sat down. She didn't rush to answer. She looked at Maya directly, the way you look at someone when you're about to tell them something real. "Yes," she said. "I helped." "Is she okay?" "She's out of surgery. The doctors fixed what was hurt inside her." She paused. "Your mom is strong, and she's going to be here when you wake up tomorrow." Maya looked at her for a long moment. Her chin was doing that thing children's chins do when they're fighting very hard not to cry. "She protected me," she said. "In the crash, she put herself on top of me." "I know. I tried to wake her up after. She wouldn't wake up." "That must have been very scary." Maya's grip tightened on the rabbit. "I kept talking to her. I thought maybe if I talked enough she'd hear me." Her voice was very small. "Did she hear me?" Laura reached over and put her hand over Maya's. "I think she heard every word," she said, and she said it the way a person says something that is not comfort and not deflection, but simply, unmistakably, true. Maya let out a breath that had been held for a long time. They sat there together for a few minutes, not talking. The television played down the hall. Somewhere a monitor beeped twice and went quiet. Then Maya looked up at her. "You have a sad face," she said, "even when you smile." Laura looked at her. "Do I?" "My grandma has a face like that. She says it's because she's seen a lot." Laura looked at the little girl for a long moment. "Your grandma sounds like a smart woman." "She is," Maya yawned, suddenly and deeply, the way small children yawn when the adrenaline finally finishes and sleep takes over like a tide. Her eyes got heavy. "Will you stay?" she asked. "Just for a little?" "Just for a little," Laura said. She stayed until Maya was asleep. It didn't take long. When the girl's breathing evened out, Laura stood up, tucked the blanket up around her shoulder, and walked to the door. She stood in the doorway for a moment, looking back at the sleeping child, and her face did something that nobody was there to see. Then she went back downstairs. 4:47 p.m. Dr. Harlan Voss had been at St. Alder's for 9 years. He was not the chief of surgery. He was not the department head. He was, however, the loudest voice in any room he occupied, and he had learned early that volume, in a hospital setting, is often mistaken for authority. He was a good surgeon. That was the honest truth, and nobody would have disputed it. His technical skill was real. His success rates were documented. But the other things about him were also real and also documented, at least in the informal ledger that hospital staff keep in their memories. The way he spoke to nurses, the way he moved through a space as though other people's bodies were inconvenient obstacles, the way he had of making a junior resident feel, in a single glance, that every decision they'd ever made had been slightly wrong. He had been in the OR during most of the afternoon's chaos. He came down at 4:47 to find his name on 3 surgical consult requests that had been filled by other doctors, and to find, at the charge desk, a conversation happening between Val Torres and a second-year resident named Greg Park about the intake nurse who had apparently done something that afternoon that people were still talking about. Voss didn't stop walking, but he slowed. "Who's the nurse?" he asked. Val looked up. "Keating. Laura Keating. She's been here about 2 weeks."
She's on intake?
"She was assigned intake, yes." Voss looked at the board, looked at the 3 names. His jaw tightened in a specific way that people who worked with him had learned to recognize. She walked into Whitmore's trauma bay? She flagged a splenic lac on a patient Whitmore's team had already assessed and cleared for monitoring. She was right. Voss said nothing for a moment. He looked toward the intake desk. Laura was still there, working. He looked at her the way a man looks at something that has entered his territory without asking permission. Who authorized her to practice outside her assigned role? Val's expression stayed professional. She flagged concerns through appropriate channels. Sandra Okafor was charged. "Sandra is gone. I'm asking who authorized a nurse on intake duty to enter a trauma bay and make surgical calls." She didn't make any surgical calls. She flagged a clinical concern. She told a trauma surgeon what to do in his own bay. His voice was flat and controlled and had that particular quality of coldness that is more threatening than heat. That is not flagging a concern. That is practicing medicine without a license. Nobody said anything. Voss looked at Laura one more time. He straightened his coat. "I want to see her personnel file on my desk tomorrow morning," he said. "And someone remind her that intake nurses manage intake." He walked away. Greg Park looked at Val. Val looked at her monitor screen. Neither of them said what they were thinking. 5:19 p.m. Laura knew. The way she always knew things. Not from drama or confrontation, but from the quality of the silence that followed Voss as he moved through the floor. From the way Val wouldn't quite meet her eyes when she brought over a stack of process forms. From the particular hush that settles over a space when something is being said about you in it. She knew. She kept working. At 5:19, Dr. Whitmore came back down from the surgical floor. He looked different from before. Not tired exactly, but quieted in the way a person gets quieted by an outcome they'd been afraid of. The particular relief that sits alongside exhaustion. He went to the board first, checked his patients, made 2 notations. Then he came to the intake desk. "How's the paperwork?" he asked. "Almost done," Laura said. "How's Diane Cawley?" "Stable. She'll be in recovery overnight, probably step down to a regular floor tomorrow." He paused. "Her husband came in. He stopped, started again. He didn't know how close it was. We don't usually tell family how close it was." "No," Laura agreed. "You usually don't." Whitmore sat down. It was becoming a habit, apparently, sitting at the intake desk. "Voss is going to come after you," he said. He didn't lower his voice. He wasn't a man who whispered difficult things. Laura didn't look up from her form. "I figured. You walked into his territory. Even though it was my bay, you walked into his territory, because that's how he sees this floor. He's going to want your file. He's going to make noise about scope of practice. He's not wrong about the scope of practice issue." Whitmore looked at her. "No, he's not technically wrong." He leaned forward, elbows on his knees. "But you saved that woman's life, and he's going to spend the next 48 hours trying to make that the smaller fact." Laura finished the form, set it down, looked at Whitmore. "Dr. Whitmore, with respect, I've dealt with Harlan Voss before." He raised an eyebrow. "You know him?" "I know the type." A long pause. Whitmore studied her, that diagnostic gaze again, looking for the thing underneath. "You're going to make me ask you directly, aren't you?" "Ask me what?" "Where you came from, what you've done. Because what happened today..." He shook his head slightly, the gesture of a man who doesn't reach for disbelief easily. "You diagnosed a grade 3 splenic lac from the intake desk across a crowded ER. You caught a tension pneumo from a hallway. You did fluid resuscitation on a crash victim before the attending saw her. That's not nursing school. That's not a county clinic." Laura looked at him for a long moment. The waiting room had cleared out almost entirely. The ER had gone down to its baseline hum. Outside, through the big glass doors, the sky had gone the particular heavy gray of an early evening in a city that has had a hard day. "I worked in difficult places," she said finally, "where resources were limited, where you had to see things fast because fast was sometimes all you had." "What kind of difficult places?" She picked up her pen. "The kind where you don't file paperwork." Whitmore sat back. He looked at her steadily. He was a man who could wait, that much was clear. He had a surgeon's patience, the kind you build over years of standing at a table while something goes wrong and not letting your hands react before your brain has finished thinking. "Okay," he said. "Not tonight." He stood up. He reached into his coat pocket and set a card on the desk in front of her. A plain card, white, his name and extension. "If Voss comes at you," he said, "you call me." Laura looked at the card. She didn't pick it up. "He's not going to come at me tonight," she said. "How do you know that?" "Because it's after 5, she said, "and Voss doesn't like working late." Whitmore looked at her. Something moved through his expression that was almost, not quite, but almost, a smile. Then he walked away. Laura picked up the card. She looked at it for a moment. She put it in her pocket. 6:33 p.m. She was wrong about Voss. He came at 6:33. The floor was quieter now. The mass casualty chaos fully resolved into the ordinary emergency of an average evening. Laura was finishing the last of the day's intake forms, stacking them in the outgoing tray with the methodical satisfaction of someone closing a chapter. She heard him before she saw him. The particular rhythm of his walk, purposeful and slightly too loud, the sound of someone who wants to be heard approaching. He stopped in front of the intake desk. He was still in his surgical cap, still in scrubs, and he had a specific expression on his face that Laura had seen in other contexts on other faces. The expression of a man who has decided in advance how a conversation is going to go. "Keating," he said. "Dr. Voss. We need to talk about this afternoon." "All right." He didn't sit. He stood, arms crossed, and he looked at her from above in the way people do when they need the geometry of a situation to do some of the work for them. "You entered Whitmore's trauma bay without authorization. You made clinical assessments outside your designated role. You gave what amounted to a diagnostic directive to an attending surgeon. I shared an observation. You said, and I'm quoting from the attending's own notes, 'That's a grade 3 splenic laceration. She needs the OR right now.'" His voice was precise and flat. "That's not an observation. That's a diagnosis. And you are not a doctor." "No," Laura said, "I'm not. So you understand the problem." "I understand what you're describing." Something shifted in his expression. He had expected, perhaps, more resistance or more apology. The steady acknowledgement without either seemed to throw his calibration off slightly. He recalibrated. "I've requested your personnel file. I want to understand your training background, because what you did today either represents a significant overstep of scope or it represents a misrepresentation of credentials on your application. Either way, Diane Cawley is alive," Laura said. His jaw tightened. "That's not the point. It's the only point that matters to her daughter. Don't." His voice dropped, went colder. "Don't make this about the patient. This is about protocol. This is about a functional ER that cannot run if every nurse decides their instincts override the chain of command. Today it worked out. Next time, a nurse who thinks they know more than they do walks into a trauma bay and gets someone killed. That's the precedent you set today." Laura was quiet for a moment. She looked at him with those level, gray eyes. Her voice, when she spoke, was perfectly controlled. "Dr. Voss, I have been in situations where the chain of command had already fallen, where there was no attending to defer to, where the person closest to the patient was me, and the choice was move or watch someone die." She paused. "I moved. Every time. I'm still moving." He stared at her. The fluorescent hum of the ER filled the silence between them. "Where?" he asked. The question came out differently than his others, less controlled, more genuine. "Where were you in situations like that?" Laura looked at him for one long moment, then she looked back down at her forms. "Good night, Dr. Voss," she said. His hand came down on the desk, not hard enough to be called violent, hard enough to be called what it was, a warning, a territorial gesture, the physical language of a man who was used to being the last word. "I'm not done," he said. "I know," Laura said. She did not look up. "But I am." He stood there. The silence stretched. A passing orderly glanced over and looked away quickly. Then Voss straightened. He picked up his hand from the desk. He looked at her one more time, and in his eyes there was something past the cold authority, something uncomfortable, something almost like recognition. He walked away. Laura's pen moved steadily across the form in front of her. If her hands were shaking, nobody was close enough to see. 7:14 p.m. Priya Nair found her in the break room at 7:14, standing at the counter with a cup of coffee going cold in her hand, staring out the window at the parking structure across the street. "I heard about Voss," Priya said. "Word travels fast. This is a hospital." Priya poured herself a cup, leaned against the counter beside her. "Are you okay?" Laura looked at the parking structure. "I'm fine." "He's going to push on the file thing. He's going to find something he can use." "Maybe." "Laura," Priya turned toward her. She was young, 29, maybe 30, but she had a quality that some people are born with and others never acquire. The ability to be present in a difficult conversation without making it about themselves. "You saved 3 people today, possibly more. What you did. I've been doing this for 2 years and I've never seen anything like it. I want you to know that someone saw it, that it wasn't invisible." Laura looked at her. Something shifted behind those gray eyes, moved through and was gone. "Thank you," she said, and she meant it, the way you mean thank you when you haven't been thanked in a long time, and you'd almost forgotten how it felt. Priya nodded. She sipped her coffee. "Can I ask you something?" "You can ask." "How did you know, with Kali? You were at the intake desk. You were 50 feet away. How did you know her spleen was bleeding?" Laura was quiet for a moment. Then she said, "The way she was breathing, the way her husband was talking, the specific area she wasn't moving. There were 12 small things, none of them conclusive on their own, and together they made a picture." She paused. "You learn to read pictures fast when the alternative is not reading them at all." Priya looked at her steadily. "That's not something you learn at a county clinic." Laura smiled at her coffee. "No." "Are you going to tell me where you learned it?" "Not tonight." "Okay," Priya said. "Not tonight." She drained her cup, rinsed it, set it in the rack. At the door she stopped. "For what it's worth," she said, "whatever Voss does with that file, the people on this floor know what happened today. That doesn't go away." She left. Laura stood at the counter for a long moment. The break room was quiet. From somewhere far down the hall came the ordinary sounds of an ER at 7 in the evening. A monitor, a question, a brief laugh, the soft rhythm of a place that doesn't stop. She thought about a different place, a different kind of noise, dust and heat and the particular sound of a radio that crackled in and out, and the weight of a field kit in the dark, and a man with 3 minutes of life left in him if she didn't move fast enough. She had moved fast enough, then, and again, in places and circumstances that St. Alder's Hospital could not have imagined on its worst day. She picked up her cold coffee. She drank it anyway. 8:02 p.m. She was gathering her things to leave when Val Torres came to find her. Val had a careful expression on her face, the look of someone delivering information they're not sure what to do with. "There was a call," Val said, "about an hour ago. Someone named Marcus Chen. He said he was trying to reach a Laura Keating. She handed over a folded piece of paper. He said you'd know who he was. Laura looked at the name on the paper. For just one moment, one fraction of a second, something moved across her face that was not calm and not steady and was, unmistakably, old. Did he leave a message? Just a number, and he said, Val hesitated, he said to tell you that Whitmore called him. Laura stood very still. He said, Val continued carefully, that he was glad you were okay, and that it was time. Laura looked at the paper in her hand. She folded it once, twice, and put it in her pocket with Whitmore's card. She picked up her bag. She walked to the door. She stopped with her hand on the frame, and for a moment she stood exactly the way Sandra had stood 8 hours earlier, looking back at the floor, at the board, at the ordinary, extraordinary business of a place that saves lives. Then she walked out into the evening. Somewhere in this building, Diane Cawley was breathing steadily in a recovery room, her husband asleep in the chair beside her. Somewhere on the 6th floor, Maya Cawley was deep in a child's hard sleep, her stuffed rabbit tucked under her arm. Somewhere in administration, a personnel file was being pulled, and a man with cold eyes and careful hands was preparing to open it. And somewhere across the city, a phone was ringing, and a man named Marcus Chen was waiting for someone to pick up. Laura walked to her car. She got in. She sat for a moment in the silence. Then she took out the folded piece of paper, looked at the number, and dialed. 8:04 p.m. The phone rang twice. Then a voice came through that belonged to a man who had spent years giving orders in places where the wrong order meant a body bag. Laura. Marcus. A pause, not awkward, the kind of pause that exists between two people who have shared something too large for small talk to bridge. Whitmore called you, she said. It wasn't a question. He called the VA liaison office first. They redirected him to me. Marcus Chen's voice was measured, careful in the way a careful man gets careful when he's about to say something he's been waiting to say. He described what happened today in some detail. He shouldn't have done that. He was concerned about you. He was curious about me. There's a difference. Laura, a breath. 3 catches in 3 hours. A splenic lack from 50 feet away. He said you walked into his trauma bay like you owned it. I walked in because a woman was dying. I know why you walked in. His voice softened slightly, just slightly, the way a man's voice softens when he's talking to someone he respects enormously and worries about equally. That's who you are. That's always been who you are. He paused again. How are you, actually? She looked out through the windshield at the parking structure. One of the overhead lights was flickering, a slow, irregular pulse. I'm fine. You've been saying that for 2 years. And for 2 years it's been accurate. Laura, Whitmore is going to dig. And Voss, I know that name. Harlan Voss is not the kind of man who lets things go when he thinks his authority has been challenged. He will pull your file, and he will go through it line by line, and when the gaps don't add up, the gaps won't be his business. They will be if he makes them his business. A pause. I can make some calls. I can have certain records reclassified before he gets access. Don't. Laura, Marcus. Her voice was quiet, but it had something in it that ended conversations. I left because I needed to leave. I came here because I needed somewhere quiet. I am not asking you to protect me. I am asking you to let me handle this. A long silence. You saved a woman today, he said finally. A mother. Yes, her kid's okay? She'll be fine, he exhaled. Okay, I won't make calls, not tonight. He said the last part with a weight that meant he reserved the right to revisit the question. But Laura, it's time. Whatever you've been trying to keep quiet, it's not going to stay quiet. Not after today. She didn't answer. You can't keep doing this, he said gently. Being the most extraordinary person in the room and pretending to be ordinary. It costs too much. Good night, Marcus. Good night. A beat. Be careful. She ended the call. She sat in the car for another 2 minutes. The flickering light in the parking structure either fixed itself or she stopped noticing it. Either way, the dark settled and she drove home. 8:51 p.m. She lived in a one-bedroom apartment 12 minutes from the hospital. It was sparse in the way places get sparse when the person living in them has learned not to accumulate things, because things have weight and weight slows you down. A couch, a table, 2 chairs, a shelf with a few books and a small photograph in a plain frame that she kept turned slightly toward the wall, not all the way, just enough that you couldn't see it from across the room. She made toast. She sat at the table. She ate without tasting it. She thought about Marcus's voice. It's time. She thought about Whitmore's card in her pocket. She thought about a place 6,000 miles away and 8 years back. A forward operating base outside Mosul where the summer heat hit 115 degrees and the supply runs came twice a week if you were lucky, and the casualties came 3 times a day whether you were lucky or not. She thought about a soldier named Garrett Okafor, 22 years old from Columbus, Ohio, who had come in with his femoral artery compromised and 6 minutes of blood pressure left, and the look on his face when she told him to stay with her. Just stay with me, Garrett. Don't you go anywhere. And the way he'd looked at her like she was the whole world, because in that moment, she was. He had lived. He had gone home. He had sent her a card the following Christmas from an address in Ohio, a plain card with a Christmas tree on the front and 2 lines inside. I'm here because of you. Thank you for not letting me go. She kept the card in the frame. That was the photograph, not a photograph. A card from a 22-year-old from Columbus who was alive because she had moved fast enough. She finished her toast. She washed the plate. She went to bed. She didn't sleep for a long time. 7:18 a.m. Wednesday, she was back at 7:18, which was 12 minutes earlier than her shift start. The morning charge nurse, a man named Dennis Holt, who had the unflappable quality of someone who has worked nights for 15 years and has seen everything twice, looked up when she came in. Morning, Keating. Morning. Anything overnight I should know about? Collie in recovery is stable. Moved to room 412 at 3 a.m. Her kid came down from peds to visit at 6, which technically wasn't visiting hours, but he shrugged. Night supervisor made a call. Laura absorbed that. Good call. Voss was in at 6 as well, Dennis added, watching her carefully. Personnel office, before it was officially open. He set down his pen. Tara from HR called me to mention it because she said it felt off. A senior surgeon hand-carrying a file request to her desk before 7 a.m. Laura kept her face even. Thank you for telling me. I didn't tell you anything. He picked his pen back up. Have a good shift. She went to the intake desk. She sat down. She folded her hands. The morning moved. Patients came in. She processed them. She watched the floor the way she always watched the floor, with a particular peripheral awareness of someone who has learned that the thing you're not looking at directly is usually the thing that matters. At 8:40, Priya Nair came in for her shift, saw Laura at the desk, and walked straight over. Her expression said she had information and wasn't sure how to carry it. Voss requested a department meeting, she said, low. Whitmore's in it, and Dr. Farida Osei from administration. It's at 10. About what? About, Priya hesitated, about scope of practice guidelines, following a mass casualty event. She looked at Laura. About yesterday. Laura nodded slowly. Who else is in the meeting? Sandra got called in on her day off. And Val. Priya's voice tightened. Laura, he's building something. He's framing it as a patient safety issue. That's the language he's using. Patient safety. The irony of that sat in the air between them like something with a bad smell. He's smart, Laura said, using that framing. It's not smart, it's... Priya stopped herself, restarted. What are you going to do? My job, Laura said, until someone tells me to stop. 9:22 a.m. The meeting was in the third-floor conference room. Laura knew this because Dennis told her. Dennis was technically not supposed to tell her, but Dennis had spent 15 years on nights and had developed a finely calibrated sense of institutional injustice. She was not invited to the meeting. She sat at the intake desk and she processed 7 patients between 8:45 and 10 o'clock. An asthma attack in Bay 2, a dislocated shoulder in Bay 5, a child with a foreign object in her ear who was very unhappy about it, and 4 others. She did her job. She did it well. She did not think about the third-floor conference room. Mostly. At 10:23, her phone buzzed. A text from an unsaved number. She looked at it. This is Whitmore. Get to conference room 3B. She stared at the message for 3 seconds. She looked at Dennis. Can you cover intake for a few minutes? I've been covering intake for 15 years, he said without looking up. Go. 10:24 a.m. She could hear Voss before she opened the door. His voice had that particular quality it got when he was in a room where he believed he was the smartest person present and wanted everyone else to arrive at the same conclusion. Pattern of behavior that represents a systemic risk. This isn't about one incident. It's about what happens when we allow individuals to operate outside their defined roles, based on personal confidence rather than verified training. The liability exposure alone. Laura opened the door. The room went quiet. Voss stood at the head of the table. Whitmore sat to the right, his arms crossed, his face unreadable. Sandra Okafor was there, still in civilian clothes, her expression carrying something between exhaustion and anger. Val Torres, Dr. Farida Osei, a slim woman in her 50s, who ran hospital administration with a precision that made Whitmore look impulsive. And 2 people Laura didn't recognize, one in a suit, one taking notes. Voss looked at her. This is a closed meeting. Dr. Whitmore asked me to be here. Every head in the room turned to Whitmore. He nodded once. I did. Voss set his hands flat on the table. Edmund, this is an administrative proceeding. It's a discussion, Whitmore said, and the subject of the discussion should be present for it. His voice was completely level. Sit down, Laura. She sat. Voss looked at her for a moment with that expression she'd seen the night before, the one that lived at the cold intersection of authority and something less comfortable. Then he picked up the folder in front of him. Keating, Laura Ann, licensed RN, State of Georgia. Previous positions, he read them. The county clinic, the urgent care. He looked up. 3 years and 1 year. That's your documented clinical experience. Yes. No trauma training listed. No emergency medicine certification beyond basic RN requirements. No surgical assist experience. He closed the folder. So when you tell me you've been in difficult places, what exactly are you referring to? The room was very still. Laura looked at him. She looked at Whitmore, who gave her nothing. No help and no hindrance, just that steady diagnostic gaze. She looked at Sandra, who was looking at the table. She looked at Voss. I had a different career before nursing school, she said. What career? Military. Something shifted in the room. Not dramatically, not loudly. The way temperature shifts when a window opens. A subtle physical change that everyone registers without naming. Voss's expression recalibrated. Military Medical Corps? Combat medic. 68 whiskey. 3 deployments. She paused. Iraq, twice. Afghanistan once. The woman taking notes had stopped writing. Your resume doesn't reflect military service, Voss said. His voice had changed slightly. Not softer, more careful. I chose not to list it. Why? Because I left for personal reasons, and I wanted to move forward, not backward. She looked at him steadily. That's not a crime. No, he said, but omitting significant professional experience on a hospital application. I omitted personal history. My nursing license is current and valid. My clinical skills are demonstrable. Yesterday demonstrated them. Yesterday demonstrated, Voss said, his voice going cold again, finding its footing, that you are willing to bypass protocol and institutional authority based on your own judgment. Whatever you did in the military, this is not a war zone. We have systems here. We have chains of command. We have liability structures and patient safety protocols that exist for very specific. She saved 3 people. Sandra's voice came across the table like something thrown. Everyone looked at her. Sandra had her hands flat on the table, and she was looking at Voss with the particular expression of a woman who has been quiet long enough. Harlan, she saved 3 people. Yesterday, on this floor, while we were stretched past capacity and running on fumes. And you are sitting here at 10:30 in the morning with a folder, trying to build a case. Sandra, no. Her voice was controlled, but the weight behind it was not. I have been in emergency medicine for 20 years, and I have never once seen anyone do what she did yesterday from an intake desk. And you know what else I've never seen? I've never seen you pull a personnel file on a doctor who made a good call under pressure. I've never seen an administrative meeting called the morning after a mass casualty event to question the person who saved the most lives. She paused. What I have seen is exactly what this looks like. The silence after that was the kind that has texture. Dr. Osei looked at Voss. Then she looked at Laura. Then she looked at the 2 people she'd brought with her, the suit and the note-taker, with an expression that suggested she was making calculations. Ms. Keating, she said, her voice was precise and not unkind. I want to be direct with you. Dr. Voss has raised questions about your application that are, procedurally, valid questions. The omission of significant professional history creates a documentation issue that HR will need to address formally. She held up one hand before anyone could speak. However, the clinical outcomes from yesterday are also documented, and they reflect well on this institution and on the individuals involved. She looked at Voss. Harlan, what specifically are you asking for? Voss straightened. A formal review of scope of practice violations, possible suspension pending verification of credentials, and a clear policy statement reinforcing chain of command in trauma situations. And what are you asking for, Dr. Whitmore? Whitmore uncrossed his arms. He leaned forward. I'm asking for her to keep doing her job. Whatever we need to do on the documentation side, we do it. But this woman has skills this hospital needs, and I am not interested in watching us talk ourselves out of that because someone's authority felt challenged. Voss turned to him. Edmund, you are letting a good outcome cloud. I'm letting 3 living patients inform my opinion. Yes. Whitmore looked at him directly. That's exactly what I'm doing. Laura said nothing. She sat with her hands folded in her lap, and she let it happen around her, the way she had learned to let institutional machinery run its course, when fighting it would only slow down the thing she actually needed. Dr. Osei looked at her folder. Ms. Keating, I'm going to ask you to provide a full and accurate employment history to HR by end of business today. Complete documentation of your military service, discharge status, and any medical training received. She looked up. Can you do that? Yes. In the meantime, you remain on your assigned duties. No change in status. She closed the folder. This meeting is concluded. Voss looked at Osei, at Whitmore, at Laura. He picked up his folder. He walked out without a word. The door closed behind him. Sandra let out a breath that sounded like it had been held since 7 a.m. 11:15 a.m. In the hallway outside, Whitmore fell into step beside her. Combat medic, he said. Yes. 3 deployments. Yes. He walked with her toward the elevator, hands in his coat pockets. Laura, I made a call last night to a colleague at Walter Reed. I want you to know I did that. She stopped walking, looked at him. Marcus Chen, he said. Her jaw tightened almost imperceptibly. I know, He told me. I wasn't trying to expose you. I was trying to understand what I'd seen. He met her eyes. I was trying to understand you. You could have asked me directly. I did ask you directly. Twice. Both times you answered with something that wasn't an answer. He wasn't apologizing, but he also wasn't defensive. He was simply stating the sequence of events, the way a person does when they know they did something questionable and have decided to be honest about it. Chen didn't tell me anything confidential. He said you were decorated. He said your record was exceptional. And then he said something that I keep turning over. She waited. He said you left because you needed to save yourself for a while, instead of everyone else. Whitmore's voice was quiet. He said you'd been giving everything away for so long that you needed somewhere you could just exist. Be ordinary. Rest. He looked at her. And then on your 11th day, you walked into my trauma bay, and you were the least ordinary person I have ever seen. Laura looked at the elevator doors. I saw a woman dying. You always see them. He said it simply, not as a compliment, as a fact. That's what you do. That's what you are. He paused. The question is what we do with that. Here, at this hospital. She was quiet. Voss is going to make noise, he said. He will, but OSI is practical. And what you have, formally documented or not, is something money can't buy and a residency program can't manufacture. He looked at her. I want to talk about a different role, a real role, something that uses what you actually are. I'm an intake nurse. You're a combat-trained trauma specialist with more field experience than anyone on my surgical team. He said it flatly. The paperwork is a detail. The skills are not. The elevator arrived. Neither of them moved to get on it. Give me time, she said. How much time? I don't know yet. He nodded. He pushed the elevator button again, and this time he stepped in. The HR documentation, he said as the doors began to close. Don't minimize it. Put it all down. Every deployment, every case, every commendation. His eyes held hers through the narrowing gap. Don't be small, Laura. Not anymore. The doors closed. She stood in the hallway. The fluorescent lights hummed above her. Down the corridor, the ordinary sounds of the hospital continued, the sounds of a place that does not pause for individual reckoning. She stood there for a moment that stretched. Then she walked back to the intake desk. 12:40 p.m. She was eating lunch at her desk, which was a habit she developed without noticing, when Diane Cawley's husband appeared at the intake counter. His name was Robert. She'd learned that from the intake forms. Robert Cawley, 41, paint-stained jacket, the man who had dropped his phone in Base 6 the previous afternoon when the floor fell out from under his ordinary life. He didn't look like a man who'd slept. He looked like a man who had sat beside a hospital bed for 16 hours holding his wife's hand and was now here, at this desk, for a reason he was still working out how to articulate. Mr. Cawley, Laura said. He blinked. You know my name? I was on intake yesterday. He looked at her. He looked at her for a long moment with the particular intensity of someone whose brain is trying to match a face to a feeling, an impression to a memory. You're the one, he said finally. You're the nurse who... He stopped. The doctor upstairs told Diane this morning, after she woke up. He told her a nurse saw something nobody else had caught. His voice was unsteady in the way voices get when the emotion behind them is too large for the words available. That was you. I was one of several people involved in your wife's care. But you were the one who saw it. She held his gaze. Yes. He put both hands flat on the counter. He was crying, she realized. Not audibly, not dramatically, the kind of crying that happens in the face without the body being involved, tears moving quietly down a face that is trying hard to maintain its shape. She woke up this morning, he said. She asked for Maya, her first word. She just said, Maya. And Maya was already there. She'd been there since 6. She'd been sitting in the chair next to the bed holding her mom's hand. And when Diane said her name, Maya just... He stopped. He pressed his lips together. She just lit up. She lit up like a light turning on. Laura's hands were still under the desk. "I don't know what I would have done," he said. "I don't know what I—" He stopped again. He shook his head. "I just wanted to tell you. I asked at the desk upstairs which nurse had been involved, and they gave me several names, and I asked which specific one, was the first to catch it, and they said yours." He looked at her. "So I just wanted to come down and say thank you, because yesterday morning I had a wife and a daughter in a normal life, and this morning I still have all three, and some of that is because of you." Laura looked at him for a long moment. Robert Cawley, 41, ordinary man in a paint-stained jacket, standing at a hospital intake desk crying without making a sound. "Go be with your family," she said. Her voice was quiet and steady and full of something that was not professional distance and not sentiment, but something in between, something real. "That's the best thing you can do right now." He nodded. He straightened up. He wiped his face once with the back of his hand. "Thank you," he said again. He walked back toward the elevator. Laura watched him go. She picked up her lunch. She put it back down. She pressed her fingers flat against the desk and breathed once, slowly, all the way in and all the way out. 1:47 p.m. She was still at the desk when Val Torres came over and set a printed form in front of her. A standard HR document, employment history addendum, blank lines waiting. "Osei sent it down," Val said. "She said no rush, just by 5. Laura looked at the form. All those blank lines. "Val," she said. "Yeah? Was there a soldier named Garrett Okafor who ever presented here?" "Patient. Probably 2-3 years ago." Val frowned. "Okafor. Like Sandra's last name, yes." Val shook her head slowly. "I don't know. I'd have to check records." She looked at Laura. "Why?" Laura looked at the blank form. "No reason," she said. "Never mind." She picked up the pen. She wrote her name at the top. Then she kept writing. All of it. Every deployment. Every theater. Every commendation the military had given her for things it could barely bring itself to put into words. She wrote with the particular steadiness of someone who has carried something heavy for a long time and is finally, deliberately setting it down. She was 3/4 through when her phone buzzed. A text from Marcus Chen. One line. "Whitmore called me again. I think it's time you let people see who you are." She looked at the text. She looked at the form. She looked at the blank lines still remaining. She picked up the pen again. Outside, the ordinary world continued its ordinary business. Inside St. Alder's Hospital, on a Tuesday that had become a Wednesday, a woman sat at an intake desk filling out a form that was, line by line, dismantling the careful, ordinary life she had built around herself, like walls. She wrote until the form was full. 2:58 p.m. The form sat in Dr. Osei's inbox for 47 minutes before she opened it. Laura knew the approximate moment it was open, because that was the approximate moment Osei's assistant, a young man named Phil, who moved through the administrative floor with the particular nervous energy of someone who processes other people's significant information all day long, came down to the ER and asked her quietly if she could come upstairs at her earliest convenience. He said, earliest convenience, the way people say it when they mean now. She told Dennis. Dennis said, go. She went. Osei's office was on the 4th floor, at the end of a corridor that got quieter the further down it you walked. The sounds of the hospital thinning out until all that remained was the low hum of a building doing its work. Osei was behind her desk when Laura came in. She had the form in front of her, face up, and she was looking at it with the particular stillness of someone who has just read something that has significantly reorganized their understanding of a situation. She looked up. Sit down, please. Laura sat. Osei looked at the form again. Then she set it down, squared it against the edge of her desk, and looked at Laura directly. I want to ask you about something specific, she said, And I want you to understand that this conversation is between us, at least for now. She waited for Laura's nod. The commendation dated October of 2017, Forward Operating Base Hammer, Mosul. It references a mass casualty event, 17 casualties in under 4 hours. You are listed as the primary medical responder. Yes. The citation says you performed emergency surgical intervention on 4 of those soldiers, including one procedure described as, she glanced at the form, improvised thoracic decompression under fire using non-surgical instruments, resulting in the survival of a Staff Sergeant Dale Morrison, who would otherwise have died from tension pneumothorax. She looked up. You performed a chest decompression with non-surgical instruments while being shot at. We had limited supplies, Laura said. You adapt. Osei looked at her for a long moment. She had the expression of a person recalibrating, which was not common for her. She was a woman who very rarely needed to recalibrate. You also have a silver star, she said. Yes. That's not on your nursing resume. No. Osei sat back. She picked up a pen and turned it in her fingers. A thinking gesture, slow and deliberate. Laura, I need to ask you something that may feel personal, and I want you to understand it comes from a practical place and not an intrusive one. She paused. Why a nursing license? Why intake? Why here, at this level, after everything this document describes? Laura was quiet for a moment. Then she said, because I needed to stop being the person who decides who lives. Osei didn't react immediately. She let the sentence sit. Then she said very carefully, and how is that going? Laura looked at her. Something moved through her expression that was almost humor and almost grief and was essentially both at once. Not great, she said. Osei set down her pen. She folded her hands. I have a problem, she said. And the problem is this. Yesterday, this hospital received 31 trauma patients from a mass casualty event. We handled it. No deaths on our floor, which is not guaranteed in that scenario. 3 of those outcomes are directly attributable to interventions flagged by you. She looked at the form. And what I now know is that the person making those flags has more relevant trauma experience than any physician on this floor. She paused. That is not a small fact. No, Laura agreed. Voss is going to see this document, Osei said. HR is required to share it with him in the context of his formal inquiry. I can slow that down, but I cannot stop it. She looked at Laura steadily. When he sees it, the conversation changes. He's been framing this as a rogue nurse overstepping her role. This document makes that framing very difficult to maintain. She tilted her head slightly. But it also means you become visible, in a way you've been avoiding. Laura looked at the window, at the gray sky, at the city that didn't know her name and didn't need to. I know, she said. I want to ask you something else. Osei's voice was quieter now, more personal. Garrett Okafor. It's not a common last name. Laura turned back from the window. Her expression shifted, very slightly. I looked at our patient records after you asked Val about it, Osei said. Garrett Okafor was treated here 2 years ago. Traumatic knee injury, veteran, referred through the VA. He's fine, he's local, he works in construction. She paused. He lists his emergency contact as Sandra Okafor, his mother. The silence that followed was complete. You didn't know, Osei said. It wasn't a question. No, Laura said. Her voice was careful. I didn't know she was here. When I applied, she stopped. Garrett was one of mine, in Mosul. He came in with a femoral bleed and 6 minutes of pressure. I got him out. She looked at Osei. I didn't know his mother was the charge nurse on the floor I was applying to. Does Sandra know about you? Who you are? No, Laura shook her head. She knows my name. She doesn't know the connection. Osei looked at her for a long moment. Something passed across her face that was not strictly administrative. That's, she began. Then she stopped. started again. That's a remarkable coincidence. I've stopped believing in coincidences, Laura said quietly. 3:44 p.m. She went back downstairs. She sat at the intake desk. She processed patients. A man with a laceration. A woman with chest pain that turned out to be severe heartburn. A teenager with a sprained ankle. She worked with the focused, methodical attention she always worked with. And under it, below the surface, something was moving. A current of feeling she hadn't allowed herself in a long time. A reckoning arriving the way weather arrives. Something you can feel before you can see. Sandra Okafor was not scheduled today. That was something Laura was conscious of, at a low level, all afternoon. The fact of Sandra's absence and what it meant for the conversation that was going to have to happen between them, eventually, whether Laura wanted it to or not. She was thinking about that conversation, or more precisely, trying not to think about it, when Priya Nair came to the desk at 3:44 with an expression that meant new information and not the comfortable kind. Voss talked to two of the residents, Priya said. She sat in the empty chair, elbows on knees, voice low. Martinez and Park. He asked them to document their observations from yesterday, specifically whether they saw you administer treatment or give directives without authorization. Laura kept her eyes on her current form. And Martinez told him she saw you start an IV on Carol Merritt before an attending had assessed her. Priya paused. Which is technically true. It is technically true. She also told him she thought you probably saved Merritt's life by doing it. He apparently didn't include that part in his documentation request. Priya's jaw was tight. Park refused to give a statement. He said he didn't feel comfortable characterizing clinical decisions as protocol violations when the outcomes were positive. Voss told him that wasn't his call to make. Laura looked up. How is Park? Shaken. Voss has a way of making a second-year resident feel like their career is one wrong answer away from ending. She looked at Laura. He's going after you hard. I need you to understand that. This isn't him venting frustration. He is constructing a case. I know. What are you going to do? I already did it, Laura said. I filed the HR addendum. Priya frowned. What was on it? Everything. Priya looked at her. The full weight of that word took a moment to settle. Then her eyes widened slightly. Everything. 3 deployments, combat medic certification, advanced trauma life support, earned in the field, surgical assist training, the commendations. She paused. All of it. Priya sat back. She looked at the intake desk, at the forms, at Laura's hands. How, she said slowly, did you end up at an intake desk? I applied for a nursing position. They gave me intake. Laura. I wanted quiet, Laura said, simply, directly. The way you say something that is both true and insufficient, and you know it is both. I had earned quiet. Priya was silent for a moment. Then she said, when Voss sees that file, and he's going to see it today, because he has HR people who owe him favors. She stopped. It's not going to make him back down. I want you to be prepared for that. It might actually make it worse. How? Because the question stops being, why was this nurse overstepping? The question becomes, why was this person ever put on intake in the first place? She looked at Laura carefully. And that question goes to Whitmore. And to Osei, and it starts a whole different conversation about institutional decisions. She paused. Voss will use that. He'll try to make this about the hospital's failure to properly place you, which makes everyone complicit, which makes everyone defensive, which isolates you. Laura looked at her. Priya Nair was 29 years old, and she had just mapped a political situation with the precision of someone 3 times her age. How do you know all this? Laura asked. My father is a hospital administrator, Priya said. I grew up watching these fights. She looked at Laura steadily. You need allies. You have Whitmore. You need at least one more person with institutional weight. Who? Sandra Okafor. The name sat in the air. Laura said nothing. She has 20 years on this floor, Priya continued. The nursing staff respects her the way they don't respect most people. If she goes to bat for you, it changes the dynamic in that room. Voss loses his audience. She paused. Talk to her. It's complicated, Laura said. Everything's complicated. Talk to her anyway. 4:30 p.m. She called Sandra at 4:30 from the break room, standing at the same counter where she'd stood the night before, with her cold coffee and her memories. The phone rang 3 times. Keating. Sandra's voice was alert, not surprised. She'd probably seen the number come through on the hospital directory system. I need to tell you something, Laura said, and I need to tell you in person. Can you come in? A pause. How serious? Serious enough that I'm calling you on your day off. Sandra was quiet for a moment. Give me 40 minutes. She came in 32. Laura met her in the family consultation room on the 2nd floor, a small room with soft chairs and a box of tissues on the table, and the specific energy of a space that has absorbed a great deal of difficult news. Sandra sat. Laura sat across from her. There was no small talk. I was in Mosul, Laura said. In 2017, forward operating base Hammer, combat medic. She watched Sandra's face. A soldier came in on October 14th with a femoral artery compromise. He'd been in the field for 11 hours. He came in with 6 minutes of blood pressure. Sandra's face had gone very still. His name was Garrett, Laura said. He was 22 years old. He was from Columbus, Ohio. He had a photograph in his breast pocket of a woman who I assumed was his mother. She paused. I didn't know that woman worked at the hospital I applied to 2 years later. I want you to know that. I didn't know. The silence in the consultation room was total. Sandra stared at her. Her face was doing something that started as professional composure and was losing the battle with something else, something older and more fundamental. He's alive, Sandra said. The words came out carefully, like something she was testing with her weight before trusting it. He's been alive this whole time. He's been... Her voice fractured. She pressed her lips together. He came home. He never told me. He doesn't talk about what happened over there. He never told me how close. She stopped. He was very close, Laura said quietly. He came in saying my name. He'd heard me talking to another patient. He said, Laura, right? And I said, yes. And he said, don't let me go, Laura. And I said I wouldn't. She looked at Sandra directly. I didn't. Sandra put her hand over her mouth. She sat very still for a moment. Her eyes were full, and she was holding herself in the way a person holds themselves when they are exercising a powerful act of self-control. She breathed. She breathed again. He sent me a card, Laura said, every Christmas. He keeps that card, Sandra said. Her voice had come back, but it was altered, softer at the edges. In his wallet. He says it's from someone who saved his life, and he never showed it to me because he thought it would upset me to know how bad it was. She shook her head once, slowly. I've seen that card 100 times. The Christmas tree on the front. Laura nodded. Sandra looked at her. Something was happening in her face that was not a single emotion, but a sequence of them, arriving one after another with no gaps between. Shock and grief and relief, and a staggering particular gratitude that doesn't have a name in English, but exists fully in the chest. You never told me, Sandra said. 11 days on my floor. I wasn't sure how. And now? Now Voss is building a case and I need someone in that room who knows what I am. She paused. But that's not the only reason I'm telling you. I want you to know. She held Sandra's gaze. Because Garrett asked me once what he could do for me, and I told him go home and live your life and that'll be enough. And he went home, and he's building houses somewhere in this city, and that is enough. She paused. I thought you should know that too. Sandra looked at her hands on the table. Voss has my file, Laura said. He's going to push for a formal review. Priya thinks he'll try to isolate me institutionally. Priya Nair is smart, Sandra said. Her voice was steadying, the professional coming back up through the personal, which was how Sandra worked, always. She's right about his strategy. She straightened in her chair. She was, once again, fully present. What do you need? 5:10 p.m. What happened next moved fast. Sandra called a floor meeting at 5:10 that was technically optional and practically not. 20 nurses, 3 residents including Park and Martinez, 2 techs, and Dennis Holt, who technically wasn't on shift, but appeared anyway in the way Dennis appeared whenever something worth watching was happening. She stood in the middle of the room, and she did not prepare remarks. She spoke the way she had always spoken, directly, without performance. Yesterday we ran a mass casualty event, she said. 31 patients. No deaths on this floor. I want everyone to understand what that outcome required. She looked around the room. It required Laura Keating to use skills that are more extensive than her assigned role suggests. I am telling you this because there is currently a process underway to characterize what she did as a protocol violation. I want the people in this room to understand the full picture before that conversation becomes official. She paused. She is a decorated combat medic with 3 deployments and more trauma experience than most attending physicians. She was assigned to intake because that was the position available when she applied. She filled it. And yesterday, when 31 people came through those doors, she filled every role that was needed. The room was very quiet. Martinez was looking at the floor. Park was looking at Sandra with an expression of visible relief, the expression of someone who has been waiting for a grown-up to arrive. I am not asking anyone to do anything they're uncomfortable with, Sandra said. But if anyone is asked to provide a formal statement about what they observed yesterday, I am asking you to tell the truth. All of it. Not the part that fits a predetermined conclusion. All of it. She looked around the room one more time. That's it. She stepped back. Nobody moved for a moment. Then Martinez raised her hand. She was a small woman, first-year resident, and her face was carrying something that looked like it had been heavy all day. I want to amend my statement, she said. To Dr. Voss, I want to add the context I left out. Sandra looked at her. Talk to HR. Tell them you have an addition. Martinez nodded. She exhaled like something had been released. 5:58 p.m. Voss found out about the floor meeting at 5:58. Laura was at the desk when he came through the doors with the particular stride of a man who has just been handed information he didn't anticipate. He stopped in front of her. Sandra Okafor just ran an unsanctioned staff briefing. I heard, Laura said. You asked her to do that. I told her the truth about who I am. What she did with it was her decision. He stared at her. His expression had moved through its familiar progressions and arrived somewhere new, somewhere she hadn't seen on him before. It wasn't cold. It was almost, and she would have found this hard to believe 12 hours earlier, almost uncertain. I've seen your file, he said. His voice was different. Still controlled, but the architecture had changed. I know. Silver Star. Yes. He was quiet for a moment. My brother did 2 tours, he said. She hadn't expected that. Nothing in his face had prepared her for it. Marine. Came back different. He stopped. He looked like a man who had started saying something and surprised himself with where it went. He doesn't talk about it either. Laura looked at him. That doesn't change the protocol issue, he said, and she could hear him trying to get back to solid ground, trying to find the argument he'd come with. Scope of practice exists for a reason. The fact that you're qualified doesn't retroactively authorize what you did. You're right, she said. He blinked. You agree with me. On that specific point, yes. The system exists for a reason. What I did was outside the system. She held his gaze. So was Mosul. So was Fallujah. So was the moment when the system breaks down and someone has to decide whether to follow the rules or save the life in front of them. I have made that decision many times, Dr. Voss. I have never made it wrong. He stood there. The evening shift was arriving around them, people passing with the business-like urgency of healthcare at change of shift. And in the middle of it all, these two people, standing 3 feet apart, conducting a conversation that had moved past its starting point and into something neither of them had planned. "What do you want from this hospital?" he asked finally. It was the most honest question he had asked her. She recognized it. "I want to do the work," she said. "The real work. Not in spite of the system. Inside it." She paused. "I came here because I needed to stop being at war. I didn't come here to fight a different kind of war." She looked at him steadily. "I'm tired, Dr. Voss. I have been tired for a long time, and I am very good at what I do, and I want to do it here, in this place, without having to prove myself every day by saving someone's life in front of an audience." The room moved around them. Voss looked at her for a long moment. His jaw worked once. Then he said very quietly, "I'm going to withdraw the formal inquiry." She said nothing. "I'm not doing it because of the file," he said, and there was something in his voice that might have been the closest thing to honesty he had given anyone in years. "I'm doing it because Martinez amended her statement and Park refused to file one, and Sandra Okafor has 20 years on this floor, and the moment she walks into that room, my case falls apart." He paused. "But I want you to know something." "Go ahead." "If you ever walk into my trauma bay uninvited again," he said, "I expect you to be right." Laura looked at him. That thing moved behind her eyes. The thing that was somewhere between humor and grief and utterly human. "I'm always right," she said. He held her gaze for one more second. Then he walked away. 6:45 p.m. Whitmore heard about the withdrawn inquiry from OSE at 6:30. He came downstairs at 6:45. He didn't say anything. He just looked at Laura across the floor with an expression that was not surprise and not satisfaction, but something more complex and more quiet. She looked back at him. He gave her a single nod. She gave him one back. That was the whole conversation. At 7, Priya found her in the break room. Same counter, different coffee, hot this time. "Voss backed down," Priya said. "Yes." "What did you say to him?" "The truth." Priya looked at her for a moment. "The truth worked?" "It usually does," Laura said. "It's just slow." Priya leaned against the counter beside her. Outside, the city had gone fully dark, and the parking structure lights were steady tonight. No flickering, just the clean, even glow of a structure doing its job. "So what happens now?" "Whitmore wants to talk about a new role." "What kind of role?" "I don't know yet." "Are you going to take it?" Laura turned her coffee cup in her hands. "I've been thinking about something a patient said to me yesterday. 8 years old. She said I have a sad face even when I smile." Priya was quiet. "Her grandmother has the same face," Laura said, "because she's seen a lot." She paused. "I don't want to not see a lot. I don't think I can do that now. Too much already in here." She touched her temple once, briefly. "But maybe the face can change a little." "That sounds like a yes," Priya said. "It might be," Laura said. At 7:43, Sandra Okafor appeared in the break room doorway. She had changed out of civilian clothes into scrubs. She was not on shift. She had apparently decided to be there anyway. She looked at Laura. "Garrett called me an hour ago," she said. "I told him about you, that you were here, that I knew." She stopped. Her voice was level, but it was carrying a great deal underneath the level. "He cried. He's not a crier. He cried for about 3 minutes on the phone, and then he told me to tell you." She stopped again, pressed her lips together once. "Tell me what?" Laura said. "He said to tell you that he named his daughter Laura." She let that sit for a moment. "She's 18 months old. He never told anyone where the name came from." Sandra looked at her. "Now I know." The break room was very quiet. Laura set down her coffee cup, very carefully. with the precision of someone who is doing something small because their hands need something to do. She looked at Sandra. She did not speak. She didn't need to. Sandra walked to the counter, poured herself a coffee, stood beside Laura in the quiet. The three of them, though one was elsewhere, in a house somewhere in the city, an 18-month-old girl with a name she didn't know the story of yet. "Come to dinner Sunday," Sandra said. "He wants to thank you himself." Laura looked at her coffee. "Okay," she said, just that word. Outside, the hospital went on doing what hospitals do. The monitors beeped, the wheels rolled, the doors opened and closed for the people who needed them. And in a break room on the first floor, two women stood at a counter in the kind of quiet that doesn't need to be filled. The kind that only exists between people who have come to understand something important together, in the particular way that important things get understood. Not all at once, and not without cost, but fully, and for keeps. 8:12 p.m., Wednesday. She drove home the same way she always drove home. 12 minutes, same streets, same turns, same parking spot in front of the building that had become, without fanfare, the place she lived. But something about the drive felt different tonight. Not the road, her. She sat in the parked car for a moment after she turned off the engine. The street was quiet. A dog was barking somewhere 2 blocks over, persistent and unhurried. The kind of sound that belongs to an ordinary evening in an ordinary neighborhood. The sound of a world that does not know or care about what happened today. Laura Keating had a daughter named after her. Somewhere in this city, in a house she'd never been to, an 18-month-old girl was sleeping or not sleeping, building the first small memories of a life that existed, partly because of what Laura had done in a field hospital outside Mosul on a hot October night 8 years ago. She turned that fact over in her mind the way you turn something fragile, carefully, making sure it's real before you trust your full weight to it. It was real. She got out of the car and went inside. She made dinner this time. Actual dinner. Pasta. Sauce from a jar. Nothing impressive. She sat at the table and ate it hot and tasted it, which was different from the night before. She thought about Sunday, Sandra's house. Garrett Okafor, who had grown up and built things, and named his daughter after a woman he'd met once in a war. She thought about what she would say to him. She decided she would figure that out when she got there. She looked at the photograph on the shelf, the card in the plain frame with the Christmas tree on the front. 2 lines. "I'm here because of you." She got up and turned it fully toward the room. Then she went to bed, and this time, she slept. 8:47 a.m., Thursday. She was at her desk at 8:47. Dennis gave her a coffee without being asked, which was new. Priya waved from across the floor with the energy of someone who had slept well and arrived early because something was happening, not because something was wrong, which was a different quality entirely. The ER was at its Thursday morning rhythm, steadier than Tuesday, lighter than the Monday of a long weekend. The board had 12 patients, 4 of them holdovers from overnight, nobody critical, nobody in immediate danger. It was, by most definitions, a normal morning. At 9:03, Dr. Whitmore appeared. He was in early, which was not unusual. But he came directly to the intake desk, which was, and he had a folder under his arm, which meant a conversation with documentation attached. He sat in the chair beside her. He set the folder on the desk. He did not open it immediately. "How are you this morning?" he asked. "Good," she said, and meant it, which was also new. He looked at her for a moment with the diagnostic attention she had grown accustomed to from him. Then, apparently satisfied with what he found, he opened the folder. "I spoke with Ose last night after she spoke with you, and I spoke with her again this morning." He turned the folder toward her. "We want to offer you a new position." She looked at the document. It was a formal job description, freshly written, the ink practically still damp with intention. Trauma Liaison Specialist. That was the title at the top. Below it, a scope of practice definition that had been written very carefully, by someone who understood both the legal parameters of nursing certification and the practical reality of what Laura Keating could do. It outlined a role that existed between nursing and surgical assistance, a formal bridge position with protocols for clinical escalation that gave her defined authority to intervene and flag in trauma situations. At the bottom, a salary figure that was significantly different from intake. She read it twice. "This position doesn't exist in standard hospital classifications," she said. "No," Whitmore agreed. "Osei created it last night." She said, and I'm quoting her directly, that she had spent 30 years in hospital administration, and she had never seen a resource wasted more comprehensively than Laura Keating at an intake desk. He paused. "She is not typically given to that kind of language." "It's a strong statement. It's an accurate one." He looked at her steadily. "You would report to me clinically and to Osei administratively. Your military training would be formally recognized within the hospital's credentialing system, working with Dr. Chen at Walter Reed, who has already agreed to assist with the documentation." She looked at the folder. She looked at her name in the title line of the document, Laura A. Keating, Trauma Liaison Specialist, and felt the particular strange sensation of seeing yourself named accurately in print after a long time of being named wrong. "What about Voss?" she asked. Voss withdrew his inquiry. "Whatever conversation you had with him last night," Whitmore paused, and she could see him deciding not to ask what she'd said. "He is not going to be a problem." "That's not what I mean. What about working with him, clinically, on this floor?" Whitmore was quiet for a moment. "He's a good surgeon," he said carefully. "His patient outcomes are excellent. His interpersonal skills are—" He stopped. "Complicated," Laura offered. "Chronically underdeveloped," Whitmore said. "But he is not stupid. What he saw Tuesday changed something for him. I don't know what exactly, but I watched him in Trauma 3 this morning, and he called a second-year resident over to explain his reasoning on a decision, which he has never done in 9 years. He looked at her. "I don't know what you said to him, but something shifted." "I told him I was tired," she said. Whitmore looked at her. "People like Voss spend so much energy maintaining a position that they forget why they took the position in the first place," she said. "He became a surgeon because he wanted to save lives. Somewhere along the way, he started spending more energy protecting his territory than saving lives." She paused. "I just reminded him of the order of priority." Whitmore was quiet for a long moment. "You told a man with a 20-year ego problem that he had his priorities backwards, and he listened. I told him I was tired of fighting when the actual work was right in front of us. I think he was tired too." She looked at the job description again. "He just didn't know he was allowed to say it." 10:15 a.m. She signed the document at 10:15. Whitmore countersigned it. They walked together to Osei's office, and Osei signed it with the efficient brevity of someone who had already made the decision and was now completing the formality. She shook Laura's hand, which she had not done before, and said, "Welcome to St. Alders, Ms. Keating. Properly this time." "Thank you," Laura said. "Don't thank me," Osei said. 31 patients. No floor deaths. I am acting entirely in the hospital's interest." But there was something in her eyes that was not purely administrative, a warmth that she wore professionally but could not quite contain. "Now go do the work." Laura went back downstairs. At the nurses' station, Val Torres and Dennis Holt were standing together. And when she came through, she could tell from the quality of their not looking at her that they already knew. Hospital gossip traveled at a speed that put light to shame. She sat at the intake desk one more time. She had been told she would transition to the new role by Monday, that the rest of the week she could continue in her current assignment while the logistics were arranged. She had 4 more days at this desk. She looked at the stack of forms. She picked up her pen. Dennis appeared at her elbow. "Coffee?" "I just had one." "Second one." She looked up at him. Dennis Holt had a face that had been weathered by 15 years of night shifts into something that was simultaneously tired and completely reliable. The face of a person you could count on at 3 in the morning. "You heard," she said. "I heard. Were you always going to give me coffee when you found out?" "I've been giving you coffee since Tuesday," he said. "I just started asking." She took the coffee. 11:30 a.m. The thing nobody had anticipated was Tomas Reyes. He came back at 11:30, which patients sometimes do. Not because they're sick again, but because something is unfinished. Some emotional business that the acute care phase doesn't have room for. He came in on crutches, his left leg properly cast now, moving with the particular careful pride of someone learning a new and temporary relationship with their body. He asked at the desk for the nurse who had flagged his breathing. He was told it was Laura Keating. He came to the intake desk. He was maybe 36, compact and broad-shouldered, with the kind of face that looked like it had been tested and not broken. He stopped in front of her and looked at her and said, in a voice that was working hard to be casual and not quite succeeding, "You saved my life." "A team of people helped you," Laura said. "Don't do that," he said, not unkindly, firmly. "I know how to find out what happened. I asked every nurse on this floor. The attending didn't catch it. You caught it, from out here." He gestured at the desk, at the hallway, at the distance between where she sat and where he'd been. "My sister," he stopped. "She was in the crash too. She's okay. She got a concussion and a broken wrist, and she is okay. And I'm okay. And the only reason I'm standing here on these crutches, instead of not being anywhere, is because you were paying attention when you didn't have to." Laura looked at him for a moment. She said, "How's the pain?" He blinked. "What?" "The pneumothorax. Chest tube sites hurt for a while after. Are you managing it?" He stared at her. Then he laughed, a short, slightly disbelieving sound. "You're asking about my pain management. You came to thank me. I'm thanking you by making sure you're okay." She tilted her head slightly. "Is the pain managed?" He shook his head slowly. "Yeah, they gave me something. It's fine." He looked at her with the expression of someone trying to solve a puzzle. "You're a strange person, you know that?" "Someone told me that on my first day," she said. "I'm starting to take it as a compliment." He laughed again, properly this time. He shifted on his crutches. "My sister wants to bring food to the hospital. She's Puerto Rican, which means she processes things through cooking. If you tell her no, she'll be devastated." "Tell her the nurses' station accepts donations," Laura said, "and that Dennis Holt particularly enjoys anything with rice." From the nurses' station, Dennis called without looking up. "That is accurate information." Tomas Reyes looked between them. Something settled in his face, a particular kind of settling that happens when relief has fully landed, when the body finally believes what the mind has been slowly accepting. "Thank you," he said. The word carried everything that the conversation around it had been carefully not saying directly. "Seriously, thank you." He turned and made his way back toward the entrance, navigating the crutches with the careful concentration of the recently injured. Laura watched him go. She picked up her pen. 1:05 p.m. The afternoon delivered its ordinary emergencies. A man with a cardiac event who came in pale and frightened and left stabilized. A child who had fallen from a playground structure with a green stick fracture that would heal cleanly. An elderly woman named Harriet Bloom, 81 years old, who had come in for a suspected stroke and who, while waiting for her scan results, told Laura about her late husband and the garden he had maintained and how she still talked to him sometimes when she was weeding. Laura listened. She asked questions. She found out that Frank Bloom had grown tomatoes specifically because Harriet liked them fresh in summer, and that he'd done this for 43 years, and that the garden was still going because Harriet's granddaughter had taken it over without being asked. "She just showed up one Saturday in April," Harriet said, "with gloves and a trowel. Didn't say a word, just started." "Did you ask her why?" I didn't have to. Harriet looked at her with the clear, undecorated gaze of a woman who has seen enough to know what things are. Some things don't need explaining. You either understand love as an action or you don't. Laura was quiet for a moment. You understand it, Harriet said. It wasn't a question. I can tell. You're one of those people who shows up. It's in the way you pay attention. She paused. It's a gift, that kind of attention. I hope you know that. The scan results came back negative for stroke. Harriet Bloom had a severe tension headache and mild hypertension, and she would be fine. She was discharged at 2 with medication and instructions, and she patted Laura's hand on the way out the door with the authority of a woman who has given and received enough of the world to know what matters in it. Laura watched her go. She stood for a moment at the desk, hands still warm where Harriet's hand had been. You either understand love as an action or you don't. She thought about Garrett Okafor in a field hospital. 6 minutes of pressure, his voice saying, "Don't let me go." She thought about moving fast enough. She thought about all the times in all the places she had moved fast enough, not for recognition, not for commendations, not for anything except the fundamental refusal to let go of someone who was still reachable. She thought about a little girl named Laura, who didn't know yet why she had that name. She sat back down at the desk. 3:30 p.m. Voss appeared at 3:30. This was different from his previous appearances. No folder, no stride built for intimidation. He came to the nurse's station and checked the board, which was routine, and then he turned to where Laura was sitting and walked over with the particular slightly awkward directness of a man doing something unfamiliar. He stopped in front of the desk. He looked at her. His expression was not warm, and it was not cold. It was something in between, something that might, with time and practice, become collegial. I heard about the new position, he said. News travels fast. In this hospital, it travels at the speed of Dennis Holt's coffee rounds. Something moved at the corner of his mouth that was the structural ancestor of a smile. Trauma liaison specialist. Yes, Osei wrote the job description herself. I know. He was quiet for a moment. He looked at the board. He looked back at her. I have a patient coming in Friday. Blunt abdominal, motorcycle accident. He's stable now, but I want a second set of eyes during assessment. He paused. Eyes that know what they're looking for. Laura looked at him. If you're willing, he said, and he said it with the specific quality of a man who is not accustomed to asking and is asking anyway, which made it, in its own difficult way, a significant thing. I'll be here, she said. He nodded once. He started to turn away. Dr. Voss. He turned back. Your brother, she said. If he ever needs anything, a referral, a resource, someone to talk to who's been where he's been. She held his gaze. I know some people. Something moved in his face that he did not attempt to control or conceal. It passed quickly, but it was real, and it was human, and it was the kind of thing you see in a person's face when you have unexpectedly touched something they have been carefully protecting. Thank you, he said. He said it the way Tomas Reyes had said it, the way Robert Cauley had said it, the way the word sounds when it is carrying more than itself. He walked away. 4:45 p.m. Sandra came in at 4:45, the start of an evening shift she had apparently added herself to. She stopped at the desk and looked at Laura with the expression of a woman who has been thinking about something all day and has arrived at a position she is comfortable with. Sunday, she said, 3 o'clock. I'm making arroz con pollo because Garrett's wife is Puerto Rican, and she taught me, and it is the best thing I make. You will bring nothing. You will come and eat, and you will let my son thank you in person. She paused. And you will stop looking like you're not sure you deserve to be thanked. Laura looked at her. Is it that obvious? To a mother? Yes. Sandra sat down. He called me again this morning. He wanted to know if you were really here, really at this hospital, because he said it seemed too big to be real. She looked at Laura. I told him some things are exactly as big as they seem. Laura looked at the intake form in front of her. What time did you say? 3 o'clock. I'll be there. Sandra reached over and straightened a stack of forms on the desk that did not need straightening. It was a gesture of proximity, not practicality. Laura, she said quietly, I've been doing this job for 20 years. I've worked with hundreds of nurses, dozens of doctors, people who were skilled and people who were dedicated, and occasionally someone who was both. She paused. What you are is something I don't have a clean professional category for. What you are is someone who looks at a room full of suffering and sees every single person in it and doesn't look away. She stopped. That's not a skill set. That's a way of being in the world. And it is rarer than you know. Laura looked at her hands on the desk. You've been trying to make yourself smaller than you are, Sandra said. For how long? A while. Long enough. It wasn't a question. Laura looked up. Sandra was looking at her with the particular direct warmth of a woman who loves her son and understands, in her bones, what she owes this person sitting across from her, and who has decided that the best form of gratitude is honesty. Yeah, Laura said. Long enough. 6 p.m. She was finishing her second-to-last form of the shift when Priya came in off a break, looking like she had decided something. I applied for a trauma fellowship, she said without preamble. She sat in the empty chair. At Johns Hopkins. I've been putting it off for 8 months because I wasn't sure I was ready. She looked at Laura. I decided I'm ready. Laura looked at her. What changed? I watched you work for 3 days. She said it simply. I watched what it looks like when someone is doing exactly what they're built for, and I realized I've been doing exactly what I'm built for and treating it like a question instead of an answer. She shrugged once, a small, determined movement. I'm good at emergency medicine. I'm going to go be excellent at it instead. When did you apply? This afternoon, before I could change my mind. She paused. You might have to write me a reference. We've known each other for 3 days. You knew what was happening with Tomas Reyes's lung from 40 feet away in 30 seconds, Priya said. I think you know enough about how I work. Laura looked at her. Something warm moved through her chest, the specific warmth of watching someone step toward themselves. Send me the form, she said. Priya stood up. She started to leave. Then she turned back. The little girl who said you had a sad face. Maya. Her mom is being discharged tomorrow morning. She looked at Laura steadily. I thought you should know. 7:55 p.m. She was the last to leave again. Not out of obligation this time, not out of the exhausted momentum of someone who doesn't know where else to be. She stayed because she was finishing something real, and finishing it thoroughly. And when she set the last form in the tray and stood up, it was with the clean satisfaction of work completed, not work endured. She put on her coat. She picked up her bag. She was almost to the door when she heard her name. She turned. In the hallway outside the elevator bay, a woman was standing with a man beside her and a small girl in front of her. A girl with dark hair and one arm in a sling and a stuffed rabbit tucked under the other. The woman was moving carefully, freshly post-surgical, and the man had one hand at her back and his other hand holding what looked like a discharge folder. They had clearly just come from the elevator. They were heading for the exit, and the small girl had seen Laura first. Maya Cawley let go of her mother's hand and walked across the hallway with the focused determination of a child who has identified something important and is moving toward it. She stopped in front of Laura and looked up. You came to see me, Maya said, when Mama was in surgery. I did, Laura said. You stayed until I went to sleep. I did. Maya considered this with the solemn thoroughness of an 8-year-old conducting an evaluation. My mama says you're the reason she's okay. Your mama's doctors are the reason she's okay. She says you too. Diane Cawley had reached them now, moving slowly, Robert's hands steady at her back. She looked at Laura with an expression that needed no translation, the kind of look that goes beyond gratitude into the territory of something permanent, something that will be carried forward into every ordinary day that follows. "Ms. Keating," she said. "Ms. Cawley, how are you feeling?" Like someone operated on my abdomen 2 days ago. A small, real smile. And like I am the luckiest woman alive. She reached out and took Laura's hand. Her grip was still weak, surgery weak, but her intention was not. "I know what happened. The nurses explained it to me this morning. I know how close it was." She held Laura's gaze. "I know that you saw something nobody else saw." "You're going to be fine," Laura said. "Full recovery. Because of you. Because of a lot of people," Laura said. "And because you're strong." Diane shook her head slowly. "Don't deflect. Let me say this." Her voice was quiet and certain. "You gave my daughter her mother. There is no way to account for that. There is no way to measure it." She tightened her grip on Laura's hand. "So I am not going to try. I'm just going to say that we are going to know your name for the rest of our lives. And we are going to say it with gratitude. And that's what we have to give you." Laura looked at her. She looked at Robert, steady and quiet. She looked at Maya, who was watching all of this with the clear eyes of a child who understands that something significant is happening, even if she can't fully name it. She looked at Maya's rabbit. "What's the rabbit's name?" she asked. Maya held it up. "Captain," she said with complete seriousness. "Because he's brave." "Captain's a good name," Laura said. Maya examined her for another moment. Then she stepped forward and put her good arm around Laura's waist. It lasted 3 seconds. Small and complete and uncomplicated in the way that children's gestures are. The way they mean exactly what they are. Then she stepped back, took her father's hand, and the Cawley family moved toward the door. Laura stood in the hallway and watched them go. Diane looked back once, at the door, and nodded. Then they were through it, and the door swung closed behind them, and the ordinary evening noise of the hospital filled the space they had left. 8:23 p.m. She stood there for a moment after they were gone. She thought about what Harriet Bloom had said. You either understand love as an action or you don't. She thought about a field hospital and a 22-year-old soldier and the specific quality of darkness that exists at 3 in the morning in a place where war is happening, and the particular brightness that a life being held on to generates in that darkness. She thought about a little girl named Laura, who was 18 months old and had no idea yet. She thought about Sunday, arroz con pollo, a man on crutches who had survived, a mother who had survived, a daughter who would remember. She thought about a job description with her name on it, her real name, her real skills, written plainly in black ink without apology or reduction. She thought about Priya Nair, who had applied for a fellowship that afternoon before she could change her mind. She thought about a card in a frame, turned toward the room now, fully visible. She thought about 11 days and what they had contained, the weight of them, the cost of them, the strange and unexpected grace of them. She put on her coat. She picked up her bag. She pushed through the doors into the evening air. The city was doing what cities do at 8:20 on a weeknight, existing in all its particular, indifferent, crowded human fullness. Cars moving, people walking, lights on in windows, the ordinary texture of lives being lived, none of them aware of what had happened in that building behind her, none of them needing to be. She walked to her car. She got in. She did not sit in it this time. She started the engine. She pulled out of the parking lot. She drove through the city with the window cracked, the night air coming in cold and clean, and she was present in it, all the way present, without the glass between herself and the world that she had been building quietly for 2 years. 12 minutes later, she parked in front of her building. She went inside. She turned on the lights. She looked at the frame on the shelf, the card fully visible now, 2 lines in the handwriting of a young man who had grown up and built things and named his daughter after the person who had refused to let him go. "I'm here because of you. Thank you for not letting me go." Laura Keating had come to St. Alder's Hospital to be ordinary, to be quiet, to take up less space than she was, to heal in the particular way that people who have given too much try to heal, by giving nothing, by becoming invisible, by making themselves small enough that nothing can find them. She had managed 11 days, and in those 11 days she had seen 31 people in crisis, and had helped save the ones who needed saving, and had stood her ground against a man who wanted to make her small, and had found, in the most unlikely way, the woman whose son she had kept alive in a desert 8 years ago, and had been told, by a child who did not know how to lie, that she had a sad face even when she smiled. She was still tired, that was true. The kind of tired that lives in the bones takes longer than 11 days to lift. But something had shifted in the weight of it, the way a load shifts when it is finally, properly distributed, when the person carrying it stops carrying it alone. She was not going to be ordinary, that much was clear. She had tried it and the evidence was conclusive. But she was going to be here, in this city, in this hospital, at this work, fully and without apology, with her whole history and her whole self present, doing the things she had always done, the things she could not stop doing, no matter how small she tried to make herself. She was going to show up. She always had. She turned off the light, and for the first time in a long time, she did it because she was ready to sleep, not because she was running from the dark.